So for the dorsal implant, I'm not talking to you, be quiet. I'm talking to the video. They'll know who you are. Shh, quiet. I'm trying to hide our identity. Okay, so I'm using Flowers dorsal nasal implant, and it comes in different sizes of thickness. Right there, can you see it? Good. And I'm using 2.5 millimeter. You want to use the sizer on the first visit to figure out which one looks best, and then on the day of the visit, just like I did, to mark the area so you get a good idea of where to place it. And then you have to be meticulous with the injection, and I did the dorsum, and then from the almost an intercartilaginous area extending into the anterior septal angle. And after that, you have to clean with Benadine really well. That's the key. With these implants, the best way to avoid movement is to have a precise pocket. So when you dissect just what you need, maybe 1 millimeter, 2 millimeters more than that, but not too much, so it doesn't move. Once you have it and you put a splint on it along with tape, you're good to go. And that's what we're going to do today. So talk is easy. Let's see if we can do it or not. Okay, so we have the implant right here. We have saved the stickers off the field. This is sterile, and right away I'm putting it into Betadine to soak for like 5-10 minutes at least. I'm trying my best not to touch the implant. I'm using the Bakeys. And I'm confirming this 2.5. I looked at it, and there we go. So now I took it out of Betadine and putting it into hydrogen peroxide. At this point, I'm taking my gloves off. I had double gloves, so when I'm doing this part, everything is fresh. Always check the side that needs to go up. Remember the wide side? You can flip very easily to the wider side goes on the top and the narrow one at the bottom, so be aware of that. So now let's get this right here. Hold it like this. You don't have to go all the way, just this is gonna work, but be careful it doesn't crunch on you. So maybe let's go a tiny bit more. Right there. Good. So now I'm going to enter from this side right here. Where I made right there. I'm pushing it in. Be very forceful, don't loosen up, because that's when the problems can happen. It's all there. Okay. Now, if you pull it out, you can pull it out with it. So always use the Q-tip trick. So I'm putting the Q-tip right where the implant is while I pull this out. Actually, I'm going to use 2 Q-tips. I'm so afraid that it might pull it out. That here we go, 2 Q-tips. And open it up a little bit wiggle, 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 wiggle. There you go. So now I'm going to inspect and make sure implant hasn't come out. And if you come on the other side, you can see. If you come on the other side, I'll show you the implant. You can see the implant. Can you see it? Yes? Zoom side. So now I'm going to make sure, yep, this is the right spot. Palpating to make sure, and yeah, try to close.